Well, September is all about raising awareness for the disorder PCOS. Spectrum News 13's Eric Levy takes us in depth with an expert to learn more about the medical condition.
PCOS actually stands for polycystic ovary syndrome, and that's what we're talking about today. And we're with Dr. Mark Trolice and Sasha Adi. Thank you both for coming in today to talk about this. Dr. Trolice, I'm going to ask you, what is PCOS?
Well, PCOS is polycystic ovary syndrome, and up to 1 in 5 women actually have this problem. It's the most common hormone problem in women throughout their reproductive years and beyond. Terribly frustrating for them. There's criteria that we use to make the diagnosis, and typically patients have irregular menstrual periods, and they have some signs of elevations in male hormones, so they get some facial hair and lower abdominal hair, and also ultrasound will show some pictures of the ovaries that will be classic for that. But the real thing, Eric, is that these patients are terribly frustrated because they have abnormal bleeding and they have difficulty conceiving. So that's where I come in, is that they come to see me because they're having trouble getting pregnant. 1
in 5, you said. Is that a number that has grown over recent years, or has it been like that for a while?
Perfect question. And I think the number changes because we had always said it was about 6 to 10%, and I think it changes because the criteria are getting more and more refined. So the original criteria was back in 1990. Then 2003 is what we mostly used as Rotterdam criteria. And then the Androgen Excess Society has come up with a criteria, I think, in 2006. And they're showing more things like on ultrasound. How do we make that diagnosis? And the more refined the criteria is, you're going to start seeing now more patients being able to be diagnosed. But also, fortunately, the more awareness that we get from this, and particularly with the work of Sasha and William with the PCOS challenge, the more aware, the more doctors are being aware, and they're making the diagnosis sooner.
And we're going to talk about the PCOS challenge in just a second. I wanted to ask you, though, how many patients locally do you see several?
Well,
can you quantify it as best as you can?
The percentages of patients are actually universal. So you're going to see anywhere from, as I said, based on the criteria, some 5 to 20% of patients, but it's really across ethnic and racial barriers. It's not really limited to one country.
If you're just joining us, we're talking about polycystic ovary syndrome for today's In-Depth, and Sasha Adi and Dr. Mark Trolice are joining us. Sasha, I want to ask you about the PCOS challenge.
Yes, PCOS challenge is the National Polycystic Ovary Syndrome Association. I founded the organization after my own diagnosis and struggles with polycystic ovary syndrome and the lack of support that I received. I felt let down by the medical community, and after doing research, I realized that there were millions who were dealing with the same thing.
Why did you feel let down?
The only thing that was given to me was birth control pills, and I was told to lose weight and come back in 6 months. Wow. My insurance wouldn't pay for me to see a nutritionist because I wasn't diabetic, the very thing that I was trying to prevent. So this was very concerning and very, I felt let down.
So we know why this is important to you. How long has this event been taking place?
So the PCOS Awareness Weekend consists of the PCOS Awareness Symposium on Saturday, the 22nd, and the PCOS Challenge 5K at Harbor Park on the 23rd. This is the first time ever that we've come to Florida. Florida actually has over 850,000 women who are affected by PCOS.
Wow.
And so it's so exciting that we're bringing it here to Florida. We've been doing the PCOS Awareness Symposium for about 6 years.
I've got a couple of seconds. Is there still people? It's time for people to sign up?
Yes, please register. Go to PCOSweekend.org or PCOS5K.org, and you can sign up there and register.
Well, thank you very much, Sasha, for telling us your story and about this event, and Dr. Trolice, I appreciate you coming in and talking about this as well, giving us the medical perspective on all of this.
Sure, my
appreciate
pleasure.
it. Come back again.
My pleasure. Thank you for having us.